Hi, it's Grace Pike. I'm back with 5Features, and today we're sitting down with Dr. Haney and his staff here at Ozark Regional Vein Center. They're giving away a Vanquish package which includes 4 fat-burning treatments valued at $1,800. All you have to do is like, comment, and share this post to enter to win. Thanks for watching.
Hello, I'm Kevin Haney. I'm the founder and director of Ozark Regional Vein Center in Rogers. We treat venous disease. We treat veins all day, every day. That's what we do. We were created in 2013 and just completed our 7th year of solo practice. Treated veins prior to that at a multi-specialty clinic for about 7 years. So for the past 15 years I've dedicated all or almost all of my time to venous treatment. Every day when I get up I treat veins. That's what I do all day. We have patients from well on the other side of Harrison to well on the other side of Joplin and out in Grove, Oklahoma, and certainly the Fort Smith and River Valley areas. We see a wide range of severity. From some people come in and really all they have are cosmetic concerns. The majority usually have bulgy varicose veins and the leg hurts or aches or cramps. That would be the earlier stages. Some people have progressed beyond the bulgy veins to where they have swelling around their ankles, brown pigmentation around their ankles, or they've bled or clotted or have open ulcers from their veins. The first step for any vein assessment would be to do a thorough ultrasound. You want to look at the deep veins that are down inside the muscle, make sure that they're open, haven't had clots in them. And so you'll do a venous mapping like in this diagram behind me, where you draw out the veins that have the wrong direction flow and what you can see bulging on their skin. And then from that, we'll make a treatment plan.
Hi, I'm Becky. I'm a nurse practitioner here at Ozark Regional Vein Center. I'm a nurse practitioner that focuses exclusively on veins, as does Dr. Haney, the founder and physician here at Ozark Regional Vein Center. There's one other nurse practitioner. Her name is Jeanette. She also is extensive experience exclusively in the area of veins. We have 4 RVTs. If you come see us, you'll meet one of those. They have a degree in ultrasound. They have additional training specific to the legs, and they have all been doing this for multiple years.
We accommodate everyone at Ozark Regional Vein Center. We have a number of bilingual Spanish-speaking employees all the way from the reception desk through the treatment procedures.
So when you come in, we'll do an evaluation here. We will figure out if you have venous reflux disease, where in the leg your venous reflux is located, and what is the best treatment plan for your particular pattern of vein disease.
We treat all of our patients in office. No anesthesia is required. We use local tumescent to numb up the areas, and most patients can return back to work day of.
This kind lady is allowed us to film her leg. Okay, she's been a long-term patient of ours. She's had problems for a number of years. What's her biggest issue is that she's more advanced vein stage, where her skin down here is hard as a rock. All the fat has died and gone away, and her skin's got leathery and thick, and it itches and drives her nuts. It gets achy and itchy, and then when she catches herself scratching it, she'll scratch the top off of these little purple veins, and then they bleed on her. And so she has come back to get these veins treated. There's some underneath here are some veins that are flowing the wrong direction. We've gotten a lot of them with our previous treatment last week, but there's a few little ones here that we need to find. And then I want to go ahead and inject some of these around her ankle that have bled in the past. If I inject those, then they'll go away and they won't be at risk for bleeding anymore. Plus, if we get the underlying veins that are feeding into it closed, then they won't have the pressure on them to make them bleed either. The vein that we're going after is right here at the top of the screen, right here. That has 2 colors when we have the color flow on there. Red when I squeeze and blue when I let go, so that's a bad vein. So we need to put a little dose of polydocanol in there. So we turn the color off, Crystal, and I'm going to spray some alcohol on her leg, and it's right out of the freezer, so it sort of numbs her skin a little bit. And we're going to put just a little medicine in that. That's the end of her short saphenous vein is the name of that vein. And so if we get lucky, we'll hit that little guy. Here we go with a little quick poke, okay? Okay, got a little blood return in the syringe there. Now we're putting the medicine in. The vein will turn from black to white. And so now we know we've got the medicine in there. This stings a little bit. She's probably well aware of that right now. But you see the little white going up through there, and that looks perfect. That's probably good.
If you would like to schedule a free vein screening anytime, please give us a call. We've got a number here. It's 479-777-3605. Call that number, tell them you want a free vein screen, and we'll get you set up.
Probably the most common symptoms we see would be achy, heavy, crampy legs that are worse when they stand, better if they elevate, better with support hose. So when's the right time to come see us? Some people come because the pain becomes unbearable. Getting their veins treated can really dramatically improve the quality of their life. They're able to go back out and do the things they enjoy doing, whether it's exercise, fitness routines, running, or just being able to go to work without hurting.
Okay, I have got some incredible news for you. So if you will like, comment, and share this post, then we will get you entered for a free Vanquish package. That is an incredible deal. It is 4 treatments, 4 fat-burning treatments you can come in here and have done at our Renew clinic.
Okay, so these little ones that have bled around her ankle are, we want to make those go away because one of them, they're kind of raised up. You can feel them raised up above the skin, and they have pressure in them, and those veins are all stretched out from the pressure that went on up here for years. So we want to just put a little needle in those, and as you see the medicine go in, they'll just sort of vanish before your eyes. Here we go with a little poke. These do sting a little bit. The smaller the vein, the more it stings. There we go, some of them going away there. And when they go away like that, like right there above her heel, they'll come back in a few minutes and be kind of red. And then over the next few weeks, they'll just slowly start gradually disappearing. Because the medicine went in there, it was enough medicine to sort of kill the lining cells around the vein. There we go. You're doing great, you're almost done, okay? There we go.
While you are here for our free vein screening event on February 5th and 6th, we are also having an open house on our aesthetic side where we are having some really fantastic specials on our aesthetic treatments, so we can check that out. Also, on our men's clinic, we do hormone replacement therapy, and during that open house, we are having a special which is out of this world. If you get your labs drawn, then you get a free B12 shot. So that's a pretty fantastic deal that we're running here during the open house. Each person comes in individually. We will come up with a treatment plan that works with your legs, your pattern of vein disease, your symptoms, and taking into account your insurance.
Here at Ozark Regional Vein Center, we have an in-house insurance specialist who helps us get through all insurance types, including Medicaid, Medicare, and all commercial insurances. We have in-house financing options through Care Credit and Compassionate Finance.
If you would like to schedule a free vein screening anytime, please give us a call. We've got a number here. It's 479-777-3605. Call that number, tell them you want a free vein screen, and we'll get you set up. All of the procedures that we do here are with minimal amounts of downtime, minimal amounts of discomfort, thank goodness, and they're all done in the clinic. You're not put to sleep with any of it.
Here we treat cosmetic spider veins, bulgy varicose veins, venous ulcers, bleeding sites, and clots.
If you were to ask me one thing that I want to get across, it would be that we don't do vein stripping here at Ozark Regional Vein Center. That's sort of an outdated treatment for venous reflux disease. The treatments we do here are much more modern and, thank heavens, are much less painful, much fewer risks, and much less downtime.
Thank you to Dr. Haney and his staff for sharing all that useful information. And don't forget to like, comment, and share to enter to win that wonderful giveaway going on. And call 479-777-3605 to schedule your free vein screening today. Thanks for watching.